This episode is brought to you by Neurocrine Biosciences. Thank you, Neurocrine, for helping NADF continue to educate, bring about awareness, and save lives. Welcome to All Things Adrenal. Each episode, we'll hear stories from individuals living with adrenal disease, share updates on treatments, research, protocols, interview medical professionals, and explore all things adrenal together. I'm your host, Vanessa O'Rourke, NADF Community Engagement Manager and fellow adrenal warrior. Today, our guest is Julia Anthony. Julia is a designer, entrepreneur, and healthcare executive bringing both professional expertise and lived experience with a rare medical condition to the life sciences. She's a graduate of the NASDAQ Entrepreneurship Program and Johnson & Johnson's J-Labs Incubator and a Pennsylvania Pediatric Medical Device Consortium Award recipient from the Children's Hospital of Philadelphia. As founder and chief strategy officer of Solution Medical, Julia is advancing safer, easier drug delivery for treatments that require mixing at a point of care. She also holds an MS in Industrial Design from Jefferson University and serves as a reviewer for Pecori's Healthcare Horizon Scanning System, evaluating emerging healthcare innovations. With that, welcome, Julia.
Thanks, Vanessa. Appreciate the very kind introduction and opportunity to be here today.
Well, I feel like I speak for everyone when I say we are very excited to have you. Everybody loves hearing about you and your story. But for those that maybe are not familiar, tuning in for the first time, I'd love if we could kind of like rewind back in time and if you could share a bit about your personal journey with adrenal disease.
Absolutely. So I was born with congenital adrenal hyperplasia, the salt wasting variety, back in the 90s. I'm 34 years old as of earlier this month, last week actually. So at that time, there was not as much recognition or awareness or proper diagnosis or treatment compared to how there is today. That is not to say the people back then who were aware weren't working very hard. It's just that there wasn't a lot of awareness or knowledge in 1991. So my personal childhood experience with sports and, growing up and going to school and having friends is something that I learned a lot from and inspired me to have the career I have now. And also to be a part of the community and go to a lot of events in person. It's really, really exciting to go to Magic Foundation events, CARES Foundation events, NADF events. We work with a lot of groups. Unfortunately, I'm only one person, so I've not been able to get to all of them quite yet. Please know I do want to. But to meet other patients and to see what resources people today have because of all the work and innovation that's happening in the adrenal crisis and disease areas.
Well, first off, happy late birthday. I hope you had a great birthday. So you're coming from a patient perspective. You grew up with us. You were, evolving, watching your life kind of unfold. Is there a particular moment in your life that made you realize, these current standards, the treatment for an adrenal crisis, it's just not enough? Was there something that triggered that? How did you decide that you were the person? Like, you were going to be that person to make the change?
I don't know if there's any one particular event. I was always very active as a kid. My family told us anything we wanted to do, we could, which I think is a really good mindset to have for anybody growing up. But definitely having a condition and needing to advocate for that, amongst friends and their families and parents with sports and travel and just being very active was kind of difficult. I don't think it's necessarily a conversation you're trained to really have or expecting to have most of the time if you don't have one of these, circumstances that you're living with. And a lot of times people don't necessarily know how to receive that information. So just countless interactions of growing up in a world that wasn't built or designed to handle, people who have a chronic potentially life-threatening condition in a very busy world. It inspired me to want to do healthcare in general, and then realizing that the personal circumstances that I've dealt with and have could maybe help other people, just sort of decided to create my own path. I've always been told I could do whatever I wanted, even if I have this condition, and I guess I believed that enough to the point, and still do, that I decided to be the person who would at least give this a try. And it turns out it's working and going very well, so happy to be able to say that. But I'm certainly not a doctor. I probably should have led our conversation with that. And I'm not an expert in every area of innovation or drug delivery, so building out our team to be able to fill in those gaps with folks who are experts has been critical and frankly vital to our success. I'm not the person to do this. I'm the person to bring together the right team to be able to bring this to life. And you and other folks from NADF and all the other groups and folks that we work with in speech who are part of that team, for sure.
You know, I want to go back. You said, I'm not an expert. I think that was the vocabulary word that you used in medical stuff, but you are an expert in being a patient. Like, you have the practice, you have the lived experience of, you know, you were talking about you had to explain your condition. And I don't think people understand how exhausting advocating is. Just to get like basic care, to not die, to have medical treatment to keep you alive. And it's very exhausting to every place you go. I can't even imagine what it was like as a kid. I've only had it as an adult, but as a child, like having to teach your friends, teach your parent, teach the children's parents, like wherever you go, that is a very exhausting thing. So you are an expert in that. And then you took that expertise and that drive. I think I probably should have started with this next question so that way people have a better understanding. But let's dive into now what it is you're talking about. You're talking about your team and you're talking about you being the person to make this change. So for those that don't know, Julia is, you know, I want to say the head honcho spearheading this incredible project, a world-changing event in my mind, of Solution Medical. So what is Solution Medical for those that don't know?
So we are creating both a pre-filled syringe as well as an auto-injector for drugs that you mix before you inject them, starting with adrenal crisis treatment. So still maintaining the powder liquid formulation of the drug, mixing those right before you inject them to maintain shelf life and bioavailability of that drug product, but doing it in a much easier way in products that we're designing to fit into people's lifestyle. So rather than people needing to design their day around the condition that they have and what they need to carry with them, or hopefully are, we've actually learned a lot through this process. People don't carry their medicine with them, probably as much as they should. But, you know, design something that you can bring into your lifestyle. And we started as a device company only, but we actually, Vanessa, make the drug and the device. So I'm not sure if that's something people totally understand. Some of the conversations I have, I think people think we're only making the plastic parts and the springs and the needles and putting those things together. We're making all the insides as well, including the drug, the containers that they go into. We want to make sure that the full patient experience is safe and user-friendly. And in order to do that, we're controlling the entire supply chain, from the raw ingredients that make the drug to how the drug goes into the device to how users will be able to use it in a more friendly and approachable way. So, you know, just a small little undertaking started back in 2019. Really just driven by persistence and grit, I guess, and the resilience that comes with having one of these conditions that I think everybody who maybe is lacking in some areas, meaning we can't make cortisol, we certainly make up for as a community with our persistence and advocacy that we all do.
Well, let's just hold for applause because everyone's cheering and shouting in the universe that's listening to this, that understands. And those that don't, let me just break this down to you. Those of us with adrenal insufficiency or an adrenal disease that requires emergency replacement steroids, right now the medical standard is about a 15-step process of building our own medical life-saving device in a moment of a crisis. Now, supposedly this is something that can be done. I know people who have done it, but I also know many people who've not been able to successfully build the injection and give themselves the injection, and ramifications of life-altering consequences ensue. So what Julia is undertaking and talking about is taking this 15-step life-saving and almost, I don't want to say impossible, but very challenging process and turning it into either a pre-filled syringe, so you just stab a jab, or a like auto injector similar to like an EpiPen, right?
Yep.
That's huge, right? That is, we're talking 15-step challenge to is it like 1 or 2 step?
It depends which device we're talking. It's 3 or less, depending on which
3 or less
device we're talking about. Yeah.
Which, to go from 15 to 3, when you're in a state of medical emergency and your cognitive ability, your dexterity, your fine motor skills are little to none, this will literally save people's lives. And I can tell you, I hear from patients and family members and individuals in the community asking about this, whether or not they know about you or not and what Solution Medical is doing. People ask about this 24/7. So this is the most, I think, desired, needed, and important medical development for our communities. So again, let's just round of applause. I'm not going to do it because I don't want to pop the mic, but everybody just snap and give a big shout out, because Julia's been working so hard on changing all of our lives and saving lives for the community. Now, and you kind of talked about it a little bit, but like, did you have a set medical background or scientific background before starting this? You said you did medical, you were interested in it, but like, what was kind of the path?
Sure. I ended up studying kinesiology and nutrition for undergrad, and worked with a lot of people either pre or post medical operations, either to prepare them for, a procedure, or after a procedure to recover, shoulders, knees, hips, other procedures, and was finding that I got bored really quickly and was very creatively starting to take what is more of a regimen or a set of set exercises and programming, and individualizing them to people, or at least trying to make them a little more exciting and fun during pre or post, work like that. And quickly realized I wanted to do something else that wasn't really enough. I needed more creativity, even though, the body's an incredible thing and we can build it to do incredible things over time with consistency. I was getting pretty bored with the tools that I had at my disposal to help other people. So decided to either become a doctor or to do something where I got to build stuff, and went more the build stuff route. So industrial design is essentially making products that could be furniture or iPhone cases or, hard tech, to medical devices and delivery systems. So focused more on the medical device track as much as I was able to in grad school, knowing that I wanted to then use my own personal circumstances to take what I was learning in school and attempt to build a new delivery system. Quickly realizing that an empty device is pretty useless, and we're now a full pharmaceutical company, so a lot of this has been learned on the job and as we're building this for me personally. But again, recognizing that where my skill set is and surrounding, myself and building our team with experts who do know how to make drugs and mold bromobutyl rubber and, get the needles we need and et cetera. The level of detail that goes into this industry, I never realized as a patient, and I was not taught in school. And that's why our team has been so successful in helping get this achieved.
Well, and I could be wrong. I have no facts or information on this at all, but I feel like that's got to be pretty unique that you are so connected because you are impacted. This drug will save your life. So you're not just making something for money. You're not a pharmaceutical company being like, oh, let's pop out this drug and everyone will buy it. No, you're making a very niche, considered quote unquote medical device for a rare community. It's not about the money. It's about making something that will save your life, make your life easier, and for everyone within our community. And I don't think there's a lot of pharmaceutical companies out there with that same story. So this is pretty incredible.
There's not too many. A few folks who have done it, who have been successful, are mentors, which has been a great opportunity. My crazy little self just messaged them on LinkedIn, and they happened to answer, and I've been able to maintain, relationships since then. In general, I think the healthcare space is leaning more into patient-centered outcomes and wanting to have the patient voice involved in what they're making, which is a nice trend, especially post-COVID, which is a nice trend to see. But yes, I do agree that the level with which we have communication with people who will be using this one day is very unique, and it's really our superpower as a company. I think a lot of people or pharmaceutical companies focus on their area of expertise as well. So, for example, they're only focused on the management of the disease, or they're only focused on diagnostics, or they're only focused on cortisol wearable sensors, which are being worked on, and I do think are another area where there's significant need and pent-up demand, or an auto-injector for adrenal crisis. We've really mapped out internally what this whole patient journey looks like end to end. And even though right now we're only focused on the emergency situation and scenario of an adrenal crisis, everything we do, to our labeling, to our colors that we're choosing for our branding, to our company logo, things we're designing, and that I don't want to get into too much detail, and talk about, but I do tend to show at conferences in person if people do come to those, has this level of thought and detail about the patient journey built into it.
Yeah, and I don't think people understand how much goes into that. Like, I remember, and I won't share any details, but, like, I remember being a part of one of your, gosh, I can't think of the word, like, Focus group. Yeah, I remember being a part of a focus group years ago, and I was looking at certain things, and then you brought things to the table that I never even thought about before that pertained to particular patients. And I was like, I talk to these patients every day, and I never even thought about this type of accessibility. And you guys are you are not taking any shortcuts. It is so well thought out, so well planned, so considerate, and so intelligent the way you're going about it. This wasn't like you woke up in 2019 and were like, I'll make a easier thing for me and my life will be much easier. You maybe did start there, but it has been like, there's so many hills one after another that you have to climb. I don't want to say perfectly, but so precisely and so accurately that this is not something that just happens overnight. This is a very long journey, I think is what I'm trying to say.
Well, I do appreciate you saying that. We know everyone wants this yesterday and decades ago. We know people want it tomorrow, and we know everybody wants us to share our progress. And we are trying to do more of that on our social media. But we do have to do it in a way that protects what we're working on. So I do know we're falling short of people's expectations in terms of wanting to get updates more frequently. Please know that even myself as a patient, I understand the sense of urgency. It actually really frustrates me personally, right? I want to be able to share more, and I know what's happening behind the scenes. Breaking down that third wall, right? Kind of like, is it The Office, where they go and do those little side interviews and then you see what's actually happening in the office. We are working on figuring out how to break that third wall a little bit between what we're working on and what we're able to share. That in and of itself is a process. I wouldn't necessarily call that specific topic a mountain to climb, but it is a process we have to be careful with. And just please know that we are working as fast as we can with the tools that we have in the environment we have right now, which from a funding and a political and an international perspective is certainly not easy, regardless of which side of the spectrum you're with your political beliefs. I think we can all agree it's a very uncertain time in a lot of areas, and we're doing our best to go as fast as we can. And we know that this is urgent.
I think as a bystander or like a little side cheerleader, I've been of Julia in general. Like I love Julia. I love Julia's work, and we get to connect here and there over the years. And it's been such a joy to see the journey. You know, I don't know all the ins and outs of what you're doing. I know some little sprinkles here and there, but I see everything that you're doing, and I know how hard you're trying. And I think my biggest takeaway is that I wanted you to come on here to tell people, A, what you're doing, but B, to be like, it is being done and navigated so carefully and so mindfully so that we can get to point C. You know, we have to get to that point, but it is going to take time. This is not an overnight thing. The work is being done. We all want it, but no, the best of the best are at it. And as soon as we have that, you're going to be singing it. We're all going to be singing it from the rooftops about, you know, what's available and what's where. But the work is being done, I think, is really why I wanted you to come on here, just to share with everyone. Like, we hear you. We know the value. We know this would change my life. This would change your life. This would change everyone in our whole community. Are you kidding me? I don't have to. I literally went to my neighborhood meet and greet, and the local responders were going to be there. And I was like, oh, great. I'm going to go meet my EMS team. And I talked to him, asking him all about what in our county are they allowed to do? And even he, I explained to him, he was like, yeah, I'm familiar with it. I've never given an injection. We do have to get a verbal approval. Anyway, I digress. But when I pulled out my kit and I showed him, I was like, so if I showed you these steps? And he was like, whoa. His reaction was, and I was like, yeah, it's 15 steps. You have to build it. And he was like, well, I mean, we've done stuff like this, but and even seeing that transition in his face, I would love to be able instead to be like, hey, could you give me this shot? And then be like, sure.
Exactly.
We know how valuable and wonderful that would be and how life-changing that would be. So I think I'm just trying to say, it's coming. Everyone, be ready, be patient, but know that it is in the works.
And I do think, Vanessa, this isn't actually as rare as people might think. So congenital adrenal hyperplasia is rare, and Addison's is rare, and of course there's primary, secondary, tertiary, and I'm not an expert in all of these different rare conditions that make up adrenal insufficiency, but for example, I was at a conference in New York, and I was on a female-focused founder panel, which was very cool in and of itself. And someone came up afterwards and said, I think I need what you're working on, but I don't know. And they told me a little bit about their medical history and the circumstances where they now are living after having an adrenalectomy. And I said, your doctor didn't tell you about needing some sort of rescue injection potentially, or we started going to this deep dive. Never did I think going to a banking conference in New York at an international bank headquarters would result in someone in the audience coming up and actually potentially, and I hope they never do because it means that they're having an emergency, but potentially needing a Solu-Cortef or hydrocortisone injection and not having the knowledge to have one. And like I said, I'm not a doctor, so I suggested a few places in the area where maybe they could go get this knowledge. But that happens a lot. Somebody last night texted me who I met at a bar, a local bar down the street, who has a friend whose dad has Addison's. And I met them for 15 minutes at a bar. It's not as rare. Either the world's getting very small really quickly, or this is not as rare as I think some people think. And even just talking about it and advocating about doing things like this, going to these events, I'm hoping and believe that more awareness is being brought to this condition just from that one instance in New York, and I'm sure it's happening, even more. I just don't know about it. At least I hope it is. Talking about this so much, and the work that all of the groups are doing with the FDA and these other interactions and focus groups, these other companies that are working on other innovations. It's just bringing more attention in a positive way to what we're working on. We never want to hear about the stories of people passing away in the news, although those bring attention as well, unfortunately. But there's a lot of positive attention around this whole space right now.
And I think that's, the word awareness is such a word that's thrown around in so many different ways, but it is so key. And I don't think people understand maybe it's hard to see the bigger picture, like the positive ramifications of awareness when somebody does share their story or talk to someone at a bar. Like even as simple as that, talking about those things, it can save one life. And that, that doesn't, yes, a life, every life is special, but maybe sometimes that's hard to grasp, like one person, but like that one person then shares, and then that one person, whoever it's a ripple effect. And I talk about this constantly because I see it from NADF. I see it from my own personal platforms where I share my stories, people coming out of the woodworks and being like, I had no idea I had Addison's until you started sharing, and now I was able to do X, Y, and Z, and now I'm okay. And then they now become an advocate, and it is these little tiny yet mighty, powerful awareness shares. It really, it makes a world of a difference. So I like that you were talking about that there is a lot of positive awareness also happening because it's happening and it's making a major impact whether people see it or not, even if it's just one patient at a time.
Well, and the overlapping of groups too, right? So the groups, the awareness groups around the country and I believe around the world at this point, really coming together on a pretty regular basis to share what each group is experiencing so that they're able to come together and create more of an impact together. I guarantee you no one in that room when I went to that conference was expecting to hear about adrenal insufficiency. Like bankers talk about finance. They don't learn about adrenal insufficiency. So I see things in my brain as sort of a big Venn diagram and trying to overlap strategic and important groups in that Venn diagram to, as you're saying, kind of create this ripple effect and share the information in like a lot of things are silos. So share the information across the side, not just up and down, but across these different areas is happening, and it's really important. Not just wellness either.
Yeah.
Cortisol in the wellness space is very interesting. I think it gets a very bad rap.
That's a whole other rabbit hole we could go down. Yeah. And I'm sure I will at some point on this podcast have a deep dive on that.
Tired and all sorts of other things that I think are more viewed through the vein perspective, not so much the actual health perspective. And it is a life-sustaining hormone. So, for example, if people in wellness talked about the life-sustaining ramifications of cortisol and not just weight or acne or these other things, it would actually tell a bigger story and be more helpful than just,
noise.
Cortisol is this terrible thing that we all need to be afraid of. Having too much is bad, and not having enough is also bad. I think that's an area, not to digress too much, and I'm excited for when you talk about this, maybe with an expert.
Maybe with you. Maybe we'll come back and chat about it again. Or maybe there'll be a bunch of us. I don't know, but this is clearly a topic that a lot of us feel, we can pull out our soapbox.
Yeah, it's just important, again, to go across, not just up and down. And there's opportunities when you go across to share the whole story, not just that pillar or silo story.
I like that. I'm a visual person, so I like seeing that image. Okay, so you've talked about this a little bit. You're talking about the whole patient experience, but just in general, like you have this perspective that is so unique because you are starting this you are in the thick of it, of this entire production. What do you see or hope to see for the adrenal community in the next 10 years? I know 10 years is kind of just a ballpark. Let's just say the future. What are you seeing? What are you hoping? What is in the big picture?
I think Vanessa, it really just ties into what we were just talking, like connectedness. And I don't mean AI connected. Well, that's another funny thing. AI
means something different in our world.
Yeah. It's actually an acronym I try not to use too often. But when I say AI in this instance, I don't mean connectedness like tech necessarily. I mean connectedness in terms of breaking down these walls between the different pillars and silos so that care from diagnosis through management, monitoring, emergency treatment, and the education that then envelops all of that is consistent and is taught. That's what I envision. I think that is being worked on with all of the awareness that's happening with NADF and so many other great groups. It's also happening in different areas with different innovations, from new drugs to delivery systems and wearables and whatnot. It's just going to take a lot of time and a lot of persistence, all the way from EMS protocols by zip code up through the hospital, up to where is the patient when one of these emergencies happen and how can they get help as quickly as possible. I see a 100,000 foot view of what this could all look like one day, but I also know the part that we're working on in and of itself is incredibly difficult, and so are a lot of the other areas people are working on. So it's just going to take time. But I think people coming together can help it happen faster. If everyone's just doing the same thing and running past one another, you know, there's value to that sometimes, or maybe in certain circumstances, but people coming together and this like rising tides and ships analogy will really help things happen faster.
I think that's exactly right. And I honestly my next thing I was going to ask you was like, what can people do in order to help make this future happen? And really, just like you said, the community building, sharing our stories, connecting with one another, and, you know, talking to your EMS, talking to your local medical people, exploring, learning. These are all things that are going to help bolster that quicker or more efficiently. Is there anything else you think that you would want to say to people if they were
asking that question? I think is super helpful. A lot of times I think people talk, which is very, very helpful and important for camaraderie, community building, mental health, so many reasons. But being actionable about those conversations, always having some sort of action. I'm a very action-oriented person. It is a part that if that's missed, I think those conversations are great, but there's other things that could come out of it if action items are put in place. There was actually something I was just about. Let people know what you have if you feel comfortable. I'm really starting to learn more, as we're getting closer to commercialization, learn more about how disparate the EMS protocols are, how disparate hospitals, and just disconnected. All of this is. I recently moved to the place where I'm living now, not that recently, but they don't have a protocol. There's a yellow dot program here in New Jersey, which is pretty interesting for cars, which I didn't used to be a resident here, so that's really interesting. I call the local police. Oh, we've heard about that, but we never implemented it. So, but it took the phone call and it took asking. So it takes time and effort and can be really frustrating, but letting people know, as you're saying, asking how you can help in an actual actionable way. But I just think too, across the industry, things need to be standardized. Language, standardizing inclusive language is very important. Defining what these things are in a inclusive way is very important. I can't tell you how many ICD-10 codes for some sort of endocrine issue. And because there's so much disconnectedness in the codes and what they mean, that goes back to the treatment. And then also mismanagement of data or lack of data altogether. So there's so many things that are connected that it just starts with a conversation and asking how you can help. But a lot of work, I think, needs to be done in terms of coding and standardization of protocols and treatments, because you can make a device like we're doing, but if people don't know when to use it or how to use it or why to use it, and if people don't carry it, it's useless. All this work is not as valuable as it could be. So, I appreciate you letting us share about what we're working on. It is much bigger, though, than what we're working on feels like a very big thing to me because it's what I do 24/7 now for almost 7 years. But it is a small part of a much, much bigger set of problems that needs solutions.
It's a significant piece of the puzzle, if I might say.
Thank you. Yeah, I guess I just hear so much. I know people struggle. People reach out to me a lot to talk about that. So maybe I'm downplaying a little bit because I know how much work there still has to be done, so I appreciate that. But there's a lot of work that needs, and there's a lot of work that's been done. I'm not trying to discredit all the incredible work, but we got to keep going. There's a lot more work that has to be done.
All right, you heard it here, folks. Get to work. We got work to do. Well, Julia, I want to completely honor your time and energy and just thank you so much. You know I've been a huge fan of yours forever and forever will be, here to help in any way, shape, and form. If anybody wants to get involved or support you or learn more, where can we turn to? Our
website, solutionmedco.com. We're also pretty active now on Facebook and Instagram. We don't have a Twitter, not super active on LinkedIn, at least from a company perspective. But the website's a great place to go. I usually answer, maybe not right away, or I will answer and then there might be a lull. So please, I appreciate your patience. If I'm slow, it's not personal. Just super busy. But yeah, please feel free to reach out and learn how you can get involved. At the moment, my answer might be there's nothing that you can do. We just all need to hang tight and be patient as we go, through the processes we just have to go through from a regulatory perspective. But I'm always happy to meet with folks when I'm able to and be connected.
Well, and in the meantime, the work that can be done is carry your kit, tell people about it, educate people about it, train yourself on it, practice with it. There's videos online. I've got videos I've shared. NADF has videos. Learn, practice, get to work. Well, thank you.
You have to carry it.
Yes, carry your kit. That should be I'm not good at these things. Hashtag what? Carry CYK? Yeah, let's get that. Carry your kit.
I like that. Yeah, it's nice to that time. So.
Thank you so much, Julia. It's been such a pleasure. Appreciate you. And thank you for all you're doing and you continue to do. And we just can't wait to see how things unfold.
Thank you, and thanks for everything you and the NADF team are doing. And let's see that hashtag. I like that.
Yeah, it's happening. Thanks, Julia. Thanks for being here, Adrenal Warriors. I'm your host, Vanessa O'Rourke, sending you all the spoons, and I hope you have a wonderful day. Thanks for joining in on another episode of All Things Adrenal. This episode is edited and produced by Magdalene Zinke. For more information on the National Adrenal Diseases Foundation, please visit nadf.us. If you're listening on Spotify or Apple Podcasts, please leave us a rating and review to help others find out about all things adrenal. If you have a story you want to share or a question you'd like answered, reach out to NADF support at nadf.us.